As we all know, it takes some time from the identification of a patient in need until CAR infusion. And this necessarily does not only mean that manufacturing process is that long, but also the time before he can meet the CAR T-cell expert or the tumor board, the time where apheresis is appointed. This depends on an available slot, suitability for apheresis in terms of peripheral blood cell counts or last anti-cancer treatment and washout phases. And then goes, of course, to the manufacturer, but it takes, despite rapid manufacturing processes, it can take up to 4 weeks until quality release can be done. And then during that time, the patient receives bridging therapy to control his malignant disease, and before infusion also lymphodepletion. So the whole process, despite shortening the manufacturing, still takes up to 4 or more weeks.